Hello, hello, Dylan. My name is Michael. I wanted to do a little bit of a case review with you, so I figured we'd just take some time to review these things that I've come up with and some of the things that I've learned. So, Dylan, I just wanted to take a moment right now to go over some of the incidents that you've gone through, a lot of the things that you've experienced over the last few years. Um, just so we can highlight, you've been a very resilient young man. You know how to ask for help, and it seems like you have some really good supports in your life, and that's good. You also should take into account that you're a very strong individual that you've gotten to this point, and that it's important to remember that. Also, just some of the things that we want to cover is that you're in a safe place, and that will remain confidential with your information. There would be any exceptions to that would be if they would arise from child abuse or safety issues that you could harm yourself or other folks. So, just jumping into it, sometimes bad things happen to us when we're living. I know you were involved in a bad car accident, as well as watching your sister nearly drown. So some of these things would make most people feel like they're to blame, and I think we would want to blame ourselves and continue to blame ourselves. And we go to that negative thinking where we begin to feel like we're not even worthy of making it past those incidents, where we feel like, why did I get to this point? Why don't I feel good enough? So I think the problem that comes from placing that blame on each of us is that when incidents occur, we don't feel good. So we may begin to think that the world is an unsafe place and begin to pull back or get upset because we don't want to hurt other folks. If you're not careful, we let these feelings go uncontrolled. We may actually get to a place where we don't get to experience the world as a good place, or we view it as a dangerous place continually. So I think some of the things that might trigger your emotions after this incident, if you've really been a part of, just really identifying maybe even sounds, or I would even think smells could do some things. Sometimes people, after they've been a part of an incident, they may remember the smell of fire, burning wood can cause them to feel upset. So it's okay if you feel those things. If you smell something or hear something that you don't like, know that it's okay. I think really what we're going to do throughout this process is identify ways for you to feel comfortable and really begin to feel like you are wanted. You're able to move past that. I think another thing that I've come to find out about you is lost your grandfather. And I'm wondering if he sounded like he was an important part of your life. So I wonder if we can work through that as well. Kind of identifying ways to hopefully properly grieve and just really get to explore what you liked about him and things like that. I also know that you're having some issues with sleeping. Just wanted to know that we can explore that, and I want to explore that with you and find out why, in addition to what other things that are emotionally triggering you, and addressing those with you in a way that makes you feel comfortable. So we'll try to plan for some safety with that as well, in the sense that if you're coming into things that make you feel unsafe, that we'll begin to cope with them. Also want to talk with you about some of the things that'll be uncomfortable. We're going to hit them. I think it's being honest with each of us. That we're going to hit on some of those difficult topics. So I think this is a part of the plan, is knowing that we're going to hit them, and knowing when we do, you have the ability to say that. If you feel uncomfortable, say that you're uncomfortable, and we'll talk about that. We're going to explore it. Any point in time you get something that you don't like, feel free to stop me. Feel free to let me know, and we'll deal with it. But I think we're going to also need to deal with some of those things in order to move you to a good place of recovery. A lot of the times what we run into is we hit a bar, we see that bar, and then we don't want to go past it. We don't want to talk about it. But I think part of this treatment is to get you to be vulnerable and know that you're safe in this vulnerable area, but know that I'm going to be here with you too. So think of me as kind of your guide throughout this part of the process, but you're going to be the one taking the journey, and I'm going to be there with you. And there's going to be people that are coming along the way too. Really believe that we have to take that journey a little bit. Know that we're going to hit parts that will be bumpy. Know we're going to hit parts that we will like. And know that we're going to run into some things that will make it difficult. Know that those emotions are okay and acceptable. Know that it's fine. I think once you know that, we can begin to move past that in a way that is not forgetful, but mindful of who we are. It's building a part of your life. Not saying that it's going to be your life, and I'm making it more than just this therapy that we're doing. because things will happen outside these four walls, things that you're not expecting. And so we have to plan for that as well, okay? Some of the other things I know we talked about a little bit have been the anxiety at school, some of the anxiousness that you're feeling at times in other places. I think that's something we're going to want to explore too as we do some treatment planning, in the sense that we're going to look at some of the people that you have at school. We're going to look at some of the people that you have in your life. I know it's difficult right now getting in the cars. I know that when we have those, we're going to look to build out and think of some different ways to kind of approach this topic. That's going to come down to us being honest again with each of us and seeing where we can go from there. So when you feel that way, know that you can say, yes, I feel this way, and why. We're going to ask those why questions. But know that when I ask those why questions, I'm not asking you to be mean. I'm not asking you to be upset with you, but I'm asking you so that we can build a better part of where to go from here, or where to take this, okay? Do you have any questions at all, Dylan? I think that's really going to be the big part of it, that as we move through this part of your treatment, we're going to want to do a lot of different things. And think of treatment as a part of who you are. Think of it as more than your thoughts, as more than just that. We tend to get this scope of treatment where we think of treatment as, if I just do all these different things, then I'm done. We're going to have problems where we're going to wind back a bit. But know that we're going to work through that too, okay? Tell me, do you have any questions about the process so far? Anything that you think we need to do? Am I even on the right track? Feel free to tell me. I think that's really an honest part of this too. It's about working through it. If you're going to feel upset, know that you can release those emotions without knowing or feeling that someone will judge you, that I will judge you, okay? Dylan, again, I want to thank you for coming in today. I think we will take some time to build out this process. We're going to review this treatment with you and this plan. It's a plan. We're going to set good goals too, achievable goals that you feel are reachable, and then we're going to go from there. So I thank you very much for taking the time today. If you have any questions throughout, please let me know, and we'll kind of go from there. Okay, Dylan? Thank you. Have a good day.